Okay, so my favorite topic of GI is peptic ulcer disease. I think it's really interesting. But we're going to talk first about upper GI bleeds. So the severity of the GI bleed depends on if it's like venous, capillary, arterial, right? So if it's arterial, do you think you're going to see less blood or more blood when you see that person's vomit? Okay, right. So you're going to see a lot more blood. And we also have to decide whether it's acute or intermittent. And discovering the cause can be very, very frustrating and it can take a really long time. So mostly, well, 50% of the time it's from bleeding ulcers. And drugs are also a major cause. Um, but most patients who have a massive hemorrhage spontaneously stop bleeding, which is, you know, but the thing is that it needs to be identified and treated immediately. So we need to do an immediate physical exam, um, systemic, but obviously you're going to focus on the ABCs, so airway, breathing, circulation, safety. And the first line therapy is an endoscopy and endotherapy. So the goal is to like kind of like coagulate whatever is making it bleed with that endoscopy. And it's actually really interesting. Um, there's surgical therapy if the bleed continues. And then there's drugs that neutralize the hydrochloric acid and decrease the bleeding. So the nursing management for this is pretty self-explanatory. So the nursing assessment, we need to look for level of consciousness, vital signs, appearance of the jugular veins, right? Skin color, capillary refill, and then we're wanting to check the abdomen for distension, guarding, and peristalsis. So during the acute phase, we need to make sure we have accurate intake and output because this person could be losing a lot of blood, especially if it's an arterial bleed. Um, and we need to make sure they're hydrated enough. And if the patient is undergoing vasopressin therapy, we need to monitor for myocardial, visceral, and peripheral ischemia because yeah, and then just make sure that the patient's on alcohol or ulcerogenic drugs. Ulcerogenic drugs would be like NSAIDs, stuff like that. So yeah, that's my 2-minute spiel for upper GI bleed. Hope that was helpful.